So hello everyone, and thank you for joining me in this webinar. Today I'm going to be talking to you about breath analysis, a novel approach to monitoring dietary intervention outcomes. So to give you a bit of context, I'm a medical doctor by background, and my career has been both clinical work and research, and I've worked extensively in gastroenterology, respiratory disease, as well as other therapeutic areas. Right now, I work as a medical advisor for Alston Medical to guide and advise development and implementation of healthcare products within our company. Just a quick high-level introduction to Alston. We are a company of about 200 employees based primarily in Cambridge in the UK, but we do have a few colleagues over in the US as well. We are leaders in breath research, and we're actively working to get breath analysis and breath tests integrated into clinical practice. So with this webinar, my goal is to give a bit of context into the biology around hydrogen and methane and how they link into metabolism, help to understand how hydrogen and methane are also linked to health and disease, specifically gastrointestinal disease here. And finally, we'll focus on how we traditionally analyze hydrogen and methane in breath in a clinical and also research scenario, and novel approaches and devices that can now be confidently used. I'm going to spend the next couple of slides talking firstly about where hydrogen and methane are coming from in the body, and secondly, why we're particularly interested in these two gases. So when we're talking about gas production in the human gut, we're talking on the order of magnitude of 0.2 to 1.5 liters of gas a day, and about 99% of that gas is either hydrogen, methane, or carbon dioxide. So carbon dioxide is systemically produced across the body. So our focus here will be on hydrogen and methane, starting off with hydrogen as the primary gas produced by the gut microbiome. In fact, if we look at the gut microbes, you can see that around 70% of them are able to produce hydrogen, and there's a very specific phylum of bacteria that produce hydrogen within our gut. And if we go over to methane, we see a slightly different story. So rather than bacterial production, we have archaea production, in particular by the Methanobac smithii, making up 95% of methane production in an average high methane producer. If we look at the gut microbiome for a high versus low methane producer, we see around 1,000-fold elevation in the concentration of that particular archaea. So we start to understand what's behind the production of methane versus hydrogen. But how are these bacteria and archaea producing these gases? So as indicated for most of the gut fermentation, our starting input is indigestible fibers or polysaccharides. So the prime mechanism for hydrogen production is our standard glycolytic pathway. And we see downstream from this pathway other metabolites that are associated with gut fermentation, such as short-term fatty acids and propionate and acetate and butyrate. And these high levels of hydrogen can be further metabolized by methanogens, converting hydrogen and carbon dioxide into methane in the gut as well. And the important implication of this for the gut is that by reducing the total level of gas, going from 5 moles of hydrogen and carbon dioxide into 1 mole of methane. So why is the gut microbiome so important? The gut microbiome plays a critical role in human health when homeostasis is maintained, but also in disease, with all the implications of dysbiosis in gastrointestinal diseases. It consists of trillions of microorganisms that play essential roles in digestion, absorption, immune function, and even mental health. And if we have a diverse and balanced microbiome, we have better health outcomes, whilst if we have a disruption and dysbiosis, this can lead to a variety of health issues. And the microbiome is not an inert onlooker, but in turn, it interacts with the host in a variety of complex ways. There's many factors that also come into play, such as diet, lifestyle, medications, and even environmental exposures that can disrupt this balance of the microbiome, tipping the scale towards dysbiosis. And it's this dichotomy of eubiosis versus dysbiosis that we will focus on to understand how hydrogen and methane behave, and when key changes happen in the structure and composition of the gut. So the levels of hydrogen produced by the gut microbiome and excreted in breath vary on a day-to-day basis, and they're influenced, like I said, by several factors in a healthy population. By understanding these dynamics, it can provide insights into the role of the microbiome in human health and in metabolism. So we know that hydrogen is produced when unabsorbed carbohydrates reach the colon and are then fermented by the commensals of the large intestine, while methane is produced as an escape mechanism of hydrogen by archaea. So what do we usually observe in a normal population? So research shows us that in baseline conditions, hydrogen hovers around 6 parts per million, methane around 4 parts per million. After meals, especially those rich in carbohydrates, we can only expect that there's a noticeable increase as a postprandial peak in hydrogen and methane due to fermentation. And research also suggests that hydrogen and methane follow a circadian rhythm along the day and are influenced not just by the diet composition, but by other factors such as stress and sleep. And variations in the type and abundance of this gut bacteria among different individuals can affect the amount of hydrogen and methane produced. The speed at which the food moves through the digestive tract can also affect that production and microbial fermentation. And finally, as I mentioned, psychological factors such as stress, anxiety can have a tremendous impact on gut motility and ultimately on microbial activity. So what do we usually see when the scale tips towards dysbiosis in gastrointestinal disease? So, for example, the levels of hydrogen and methane can serve as biomarker indicators in an underlying conditions and link with the symptoms presented by the patient. So, for example, conditions such as lactose intolerance or malabsorption syndromes can lead to altered fermentation patterns and changes in hydrogen and methane levels, which, when there's a clinical suspicion, we can diagnose via hydrogen and methane breath tests. In IBS, for example, which is a disease characterized by abdominal pain, bloating, and changes in the bowel habits, hydrogen and methane levels are frequently altered. High levels of methane have been frequently associated in research with decreased intestinal motility and are associated with constipation, especially in patients with IBS type C. Hydrogen accumulation due to bacterial fermentation of carbohydrates in the small intestine also contributes to bloating and abdominal pain, and this is experienced in patients that are suffering from SIBO. And the very popular and accessible tool that we have to understand how these gastrointestinal conditions, including SIBO, behave is through hydrogen and methane breath tests, HMBTs. They are simple, non-invasive, and very safe ways to start to unravel this biology behind an individual's GI symptoms. And they are commonly performed in people who have IBS to rule out other underlying conditions such as carbohydrate malabsorption or, as I mentioned, SIBO. They've been extensively used in clinical practice and also in research over the last 30-odd years. And its methodology is very well characterized. They provide a very practical way of studying a person's microbiome in a very standardized way. So they reduce external factors to a minimum through general requirements such as controlling diet the night before, fasting, restriction on the use of antibiotics, probiotics, restrictions on exercise, amongst others. And they allow a collection of breath samples at multiple time points in a given day in a very standardized way to explore how hydrogen and methane change in response to a substrate challenge. While valuable and very accurate in effectively the gold standard in breath analysis as described in literature, HMBT tests do have some challenges for clinical practice and research because they require such strict compliance with the guidelines on fasting, dietary intake, and multiple other conditions. And this is often affected by poor patient preparation, which can lead to false negatives and need to repeat testing. And because of the nature of being an in-clinic lab testing as well, they require specialized equipment, consumables, and skilled personnel. And the high variability presents challenges for research as well, where you might want to understand, for example, the variation of hydrogen and methane in response to a particular food in a more real-world setting, or understand the impact of an intervention like a probiotic on the hydrogen and methane production. So to better understand this real-world condition and the complex interactions of hydrogen and methane with these external factors, we need to often collect repeated measurements, not just over a day, but over multiple days. And the analytical techniques currently used with the HMBT tests would be suitable for this, would make longitudinal analysis very, very expensive. And this is where novel devices come in as optimal tools for clinical practice and also research by making longitudinal monitoring possible at no extra cost per sample. It makes it possible to build a really, really rich understanding of the hydrogen and methane dynamics by eliminating or controlling sources of variability across a single day or several days. It allows us also to understand how patients might respond to certain interventions and challenges over a specific period of time, adapt treatment pathways in real time based on immediate device feedback, and establish links between pre-post intervention values and patient-reported outcomes. And to give you an indication of what hydrogen and methane values look like over time, I've plotted here on the right some data from our current database of breath samples using our OMED portable device. And this shows you the variability of hydrogen and methane of circa 50 individuals over the course of 6 months. And it constitutes roughly just over 3,000 breath samples. And as you can see, there's a lot of variability on a given day. So these portable tests allow not only to reduce that variability into intra-individual and inter-individual variability, but also allow for decentralization of care and remote monitoring for clinicians, allowing for the patient to continuously obtain feedback on their measurements and symptoms at the same time as their clinician is informed of the result of the treatment or any other given intervention. And this availability of data allows clinicians to quickly review and adapt their clinical pathways and ultimately reduce the need for unnecessary treatments that might not be having their intended effect. So I'd like to share with you a few use cases of our OMED device in a variety of settings, such as clinical treatment of disease, intervention with probiotics, antimicrobial supplements, and finally opportunities for specific dietary monitoring as well. So this is a case report of an individual with no significant medical history, but burdened by a variety of gastrointestinal symptoms. She was diagnosed with intestinal methanogenic overgrowth by a physician on a traditional HMBT test and went on to have an antimicrobial supplement prescribed as treatment for IMO. So this transiently improved her symptoms and the methane level started to go down, but it was still quite scattered, still quite variable, and she was still positive on a repeat test. She then underwent 2 weeks of antibiotics, rifaximin and metronidazole, and you can see on the second treatment that clearly noticeable the sharp decrease in methane values, which has led to complete resolution of symptoms. And you can see here the power of longitudinal monitoring over a long period of time, because it allows the clinicians to adapt their treatment approach and provide a quicker resolution of the patient's problem without need for repeated HMBT tests and ultimately increased costs. And this ultimately allows also to average out sources of biological variability that we talked about, things like diet, sleep, exercise, which could help you to ultimately understand better the true impact of your intervention. This is a case of a volunteer that regularly sampled their breath using the OMED device as well, building a baseline of their hydrogen and methane levels along a definite period, which then started to supplement with a probiotic. So after a continuous use of probiotic for 2 weeks, this individual had an overall lowering of their hydrogen levels and an increase of their methane levels, which reflected a significant change from their baseline, as you can see. And as we've established, if you're relying on a single point measurement, things can be quite variable, which means that you can get a lot of noise in there, and actually seeing a statistical significant change pre and post intervention can be quite challenging. And this further exemplifies the exciting opportunities to monitor the effects of a specific challenge or product along a variable period of time instead of a single time point. To give you another nice example of what longitudinal monitoring in the context of disease looks like, this is an individual which we've recently seen that had a response to a specific antimicrobial supplementation in the context of diagnosis of SIBO. So this shows that all the hydrogen measurements in the bottom during the day and across a period of several days, with, as you can see, lots of variability influenced by diet, exercise, sleep, stress, which you can then average by daily mean hydrogen measurements for a clearer picture. But after the treatment, you can that has been sent to this individual, in this particular case, was a bespoke antimicrobial treatment. You can see that the average hydrogen dropped down substantially. And this is potentially even more interesting when you look at all the hydrogen measurements, because you can see this kind of natural daily spike pattern happening even after the pronounced shift after treatment. And in this case, for example, a single point HMBT could potentially give the clinician the wrong picture, and an analysis of several measurements clearly indicates that the disease has resolved. Finally, another interesting use of breath sampling devices like our OMED device. You could take samples from patients over multiple days and really build a good understanding of what their person's natural variability, given their normal diet is, their normal lifestyle, what the natural variability of hydrogen and methane looks like before you give them any interventions, like, for example, the FODMAP diet. Then during the different phases of the diet, with the intricacies of all the FODMAP challenges, you can build a better understanding on the post-intervention effect by comparing with the individual patient's baseline. And also giving you some thoughts about how you can use this technology to actually look at the efficacy of, for example, probiotic, prebiotic, postbiotic, wherever your intervention might be in the context of research. Another big benefit of these novel devices, and for example, our device, the OMED device, is that you can see of the device that we're using here is the ability of decentralizing testing, but also the ability to monitor compliance, which could be crucial not only in clinical practice, to get a better picture if the patient is complying with the treatment that you've prescribed, but also in the research setting to see if the participant is deviating from the protocol. So devices like OMED allow you to collect a variety of data, not just hydrogen and methane, but also data on, for example, patient-reported outcomes, daily symptom trackers, sleep trackers, diet trackers, amongst others. So with the fact that all this data is collected and uploaded to the cloud almost instantaneously, you can get a picture, almost a real-time picture of what is being collected for your patient or in research for your study. And based on that, if you have a particular target that you want your patient to achieve, for example, let's say you want them to take 4 to 6 breath samples a day with your device, by accessing this data in real time, you can see if someone is we can quickly see if someone is actually complying with the protocol or the treatment that you've instituted. And if not, then you can go and discuss this with them, amend this with them, or potentially nudge them to start complying with the treatment that you've prescribed. And ultimately, all these cases really accentuate the benefits of using portable devices versus the traditional methods, because given the exciting possibilities that you have for clinical practice and research by obtaining these very rich data sets. There are the obvious cost issues with traditional methods, that are now resolved with portable devices because there's no longer consumables. You can take several samples a day, almost real-time measurement with our OMED device, which ultimately will reduce the burden on healthcare systems, allow for the patients to have faster access to diagnosis and ultimately treatment. And for clinicians as well, it makes it very convenient for them to get quick access to results, adapt their clinical pathways, and they will benefit long term from having these very rich data sets to modulate their practice further and making it really the ultimate bespoke experience for their patients. So I hope that I've been able to give everyone some useful context into how novel devices like the OMED breathalyzer, for example, can be used to support clinicians in their practice and also research in a variety of different ways. I just wanted to summarize by telling you a bit about the OMED device that we've talked about, but also covering a bit of what we'll do at Alston as well. So as a summary, we're really here to provide tools to use in breath in research and ultimately to help support translation to clinical use. We work on both on the discovery side and characterization side, and also the deployment of industry solutions. So on the discovery and characterization side, of course, you can see the new OMED device for characterization of hydrogen and methane, and to explore it as a potential biomarker for novel applications and use it to understand the efficacy of, for example, probiotics, prebiotics, how fibers are fermented, and things like that. And also, of course, we offer technologies to do volatile metabolite analysis as well. So there can be things like short chain fatty acids, and essentially all microbial metabolites. And that's probably using our Omni service and supported by the VOC Atlas that we're gathering data to understand what VOCs we can see in the breath and what the levels usually are in the context of health and disease as well. And yeah, hopefully that'll provide quite a good insight in terms of novel breath devices. So thank you very much, and I hope you enjoyed that. And if you have any questions, I'll be more than glad to answer those. So why a SIBO test and a fasted methane test? When would you use one over the other? So traditionally, if you look at the traditional HMBT kits, they measure both hydrogen and methane. They're mostly used in the context of IBS, as mentioned, and carbohydrates. Hydrogen and methane obviously can be they're specific biomarkers, specific diseases. So you'll see as a result of fermentation, elevated hydrogen. For example, if you're analyzing a specific substrate challenge for carbohydrate malabsorption, if I go back to the slides I had in the beginning, you can see that there's examples here of the traditional HMBT results. You can see here in response to a lactose intolerance test, or for example, in the context of SIBO, small intestinal bacterial overgrowth, where due to the population of bacteria in the small intestine, there'll be an early elevation of hydrogen in this particular patients. And in a subset of SIBO called IMO, you have archaea spread out in larger quantities than in a healthy adult, or you'll see archaea driving up the levels of methane, which again, there's always the component for both to be tested at the same time, because both can provide a clearer picture in the context of disease, of the variety of diseases that can be used for, such as SIBO, IMO, and carbohydrate malabsorption. The probiotics, I don't know. It was a standardized commercially available probiotic. I can try and find out and which specific one the person in the case study took, but I can't recall from the top of my head. But it wasn't anything bespoke or chosen for that purpose to drive that change. It was just case test to see if there was any changes observable by doing longitudinal monitoring. But I'll try and find out which probiotic it was, and I'll send it back. Does a client need to use a substrate for each breath test? So for breath devices, if you're trying, if you follow the current guidelines, both the European and the American ones, if you want to diagnose SIBO or carbohydrate malabsorption, you need a substrate because the guidelines dictate there's very standardized procedure. But you can use a substrate and a portable device such as the OMED device. And if you want to do a retest and retest after an intervention, you can reutilize your device. You just need to get a new substrate, which is considerably cheaper. But the device also allows for a patient and ultimately anyone who's interested in using it to obtain not only these results in terms of tests, but also to get a picture of their baseline, their real-world dynamics between hydrogen and methane in their microbiome, and then see if anything changes with any proposed intervention. So, for example, if they start a new diet or a new antibiotic treatment, they can see if, compared to baseline, and in the context of their symptoms, if there's any significant changes happening after they institute treatment. Are there any plans to integrate hydrogen sulfide into the OMED analytics? The other answer is yes. As many VOCs that we can analyze in the OMED device, would love to do that. At the moment, the device is extremely accurate in analyzing hydrogen and methane, comparing to the gold standards such as the gastrogenous breath monitor. But at the moment, just those two biomarkers. How can I get registered, and am I able to order it for my patients? Yes, so I've left a QR code at the end here. Just going to leave it at that page there. So you can scan that QR code. It will take you to the OMED health page, and through there you can order a testing device for now. And once we launch at the end of this quarter, so end of March, you'll be able to buy it for and use it with your patients as well. Does oral health matter with OMED? Yeah, so in terms of when you're speaking in terms of doing the standardized testing, such as the SIBO testing that's described in the guidelines, or the carbohydrate malabsorption testing that's described in the guidelines, we do recommend certain prerequisites before undertaking the test, because obviously you're interpreting what has been described as a very standardized test in the guidelines. So things like, for example, when you're doing a SIBO test, when can you brush your teeth prior to the test, or if you should smoke during the test, or if you should chew gum for the test. All those things are controlled for the purpose of the diagnostic test with the OMED device. But for the purpose of you monitoring longitudinally both your baseline or an intervention, there's no need to abide to any prerequisites. You can take a sample at any time with the OMED device, which is just limited to 15 minutes interval between samples, but there is no limit to how many samples you can take, and you can take it in any context, fasting, post meal, etc. There's no other conditions. How many users are there from one device? Yeah, as mentioned, so the device allows for, I would like to say, virtually unlimited users. It allows you to do as many tests as you'd like, separated by 15 minutes. Breath test with the OMED device takes about 3 minutes to complete and to get instant feedback on the values of hydrogen and methane. But you can do, as I've mentioned, any amount of tests you'd like to do, separated by 15 minutes. How can we go about and purchasing the device? So as I'll just follow the QR code and it will take us to our website. The cost of the device, yeah, it's all included in the website. The cost will vary depending on where you're purchasing from. from the US or from the UK, but you can find more information on the website. What's the effect of PPIs on the hydrogen and methane levels? Yeah, so as described extensively in literature, the chronic use of PPIs affects the results of hydrogen and methane breath tests, and that has been traditionally the reason why the gold standard for diagnosing of SIBO, for example, remains in the literature as the small intestinal bowel biopsies. However, for the purpose of doing diagnostic testing or even specific interventions and measuring breath to obtain hydrogen and methane, we usually require patients and any individual using it to abide to certain conditions, such as abstaining from the use of PPIs for a definite period of time, such as abstaining from the use. Let's say you're doing a SIBO test, you will need to comply with not taking probiotics, not taking pro-motility drugs, etc. So that for the purpose of testing and diagnostics, these things are described as affecting the levels in that specific context of a substrate challenge. But for the purpose of baseline measurement and other interventional measurements such as diet, we don't really put any prerequisites. Do you also use fructose as a substrate? So again, with the device, you can use, the purpose of testing, you can use any substrate you like. We tend to use, for the purpose of carbohydrate malabsorption, the same substrates as the traditional HMBT kits, but the device really allows you to use anything as a challenge substrate. So if you want to test, for example, the level, the change that occurs in the microbiome with a particular fiber, anything can be used to obtain a pre-post intervention picture. Does using longitudinal studies increase the sensitivity and specificity? Yeah, definitely. So what you can see with discrete measurements is that the discrete measurement doesn't really give you the picture of the variability that occurs both throughout the day in one individual and across all individuals. There's a lot of intra and inter-individual variability, not only because of the nature of the diversity of the microbiome between individuals, but also because there's a lot of confounding variables as well that will lead to different levels of hydrogen and methane, such as stress, very, very well described in literature, exercise as well, which is the reason why it's one of the controlled requirements for the traditional HMBT test, that there's no exercise in the test, because we know that it will drive down the values of hydrogen and methane. But yeah, longitudinal studies really allows us to decrease the noise and provide really, really nice data sets to observe the pre-post intervention outcomes. Do you offer students any samples or research backs really interested in working in this field? Yeah, so regarding this question, I would certainly ask you to contact our OMED Health. We can have a look at what tests and research you're conducting, and then we can have a discussion based on that. How does this work in practice? Do therapists buy the device and send it to clients? So the device is a single patient device. It can't be used across several patients. So it will be the case of a practitioner either recommending their patients to buy the device or buying for their patients. At the moment, as we've mentioned, we have not yet launched in the UK. The launch is going to happen at the end of March. But for now, if you want to purchase the device for just test its use and try and see how it will integrate with your practice, you can do that through this QR code. And if you want to discuss any other interventions that it might, and how you might integrate your device with your particular practice, you can get in touch with us. I'll be more than glad to have a discussion with you on that as well. In terms of pricing and discounts for practitioners, the information that's on the website, if you follow this QR code, is the OMED device a similar alternative to Food Marble? Yes. So Food Marble is a device that also exists in the market that does hydrogen methane analysis of breath samples. I can speak for the reliability of our device. We have conducted extensive analysis of our device, and we've shown that it's very accurate in terms of not just hydrogen, but also methane, which is what traditional devices in the market tend to be less accurate for. So we benchmarked ourselves against the Gastrogenius breath monitor, which is the gold standard for breath analysis, and the OMED device. It's very reliable. It overlaps almost perfectly with the Gastrogenius. Trio Smart measures H2S, so more favorable for practitioners. Again, Trio Smart is in the US. Trio Smart measures is a single time point test. So it's essentially the traditional HMBT test that we're talking about. H2S is important, as the metabolism of H2S is another escape route for hydrogen in the gut. So there's going to be patients that have elevated levels of hydrogen sulfide. This is something that we eventually will have in the OMED device, hopefully, but it doesn't detract from the benefit of longitudinal monitoring. Again, TrioSmart and similar companies that do H2S is a single point analysis on a particular day with a very standardized test of a specific bland diet, no exercise, a few samples into a bag. It doesn't give, in terms of longitudinal monitoring, it doesn't give the same reduced noise of the variability that we observe across individuals. I can't see any more questions, but if you do have any more questions, I reckon it's a lot of information, but if you do have any more questions you would like answered, feel free to send to OMED. I'd be more than happy to address any particular questions that you might have. And again, thank you so much for attending this webinar, and I hope I'll see you soon.